If you ask most patients what they want from their health, if you could distill to one word, it's energy. And ironically, a lot of the medications we prescribe interfere with that, our ability to make energy.
It sort of makes the patient stuck in the system. There's no escape.
Yeah, we create medical dependence on them.
That was Dr. Joe Jacko, and you've landed on the Me&my Health Up podcast. I'm your host, Anthony Harcher, nutritionist and mindset coach. This episode is around, we're talking about Dr. Joe's book on Bamboozled, Duped and Hoodwinked. And we're going to explore the medicine world. We're going to explore the behind the scenes. Dr. Joe Jacko worked for 35 years as a practicing physician in the United States. 2/3 of that was with sports performers, and he was in the optimization side of things. And then the last third of his career was working in the medical system. And he shares his insights as to what happens behind the medical system, what happens within the inner walls, the inner sanctum, and how important it is for you to get empowered through education. So without much further ado, I'd love to welcome you into the discussion I'm having with Dr. Joe Jacko. Welcome on the Me&my Health Up podcast. How are you, Dr. Joe Jacko?
I'm doing fine, Anthony. Thank you for having me again.
You're welcome. Thank you for coming on for part 2 of our discussion. So for the listeners, Dr. Joe Jacko has been on a previous episode, and we explored really holistic health. And we talked a lot about longevity principles and how you can, I guess, apply holistic health to your well-being. So we've had that discussion. And in this episode, I'm really keen to explore more Dr. Joe Jacko's book on Bamboozled, Duped and Hoodwinked. And so
Right.
I'll ask Dr. Joe to share like an executive view of the book to start with.
Well, the book is really the outcome of 35 years of increase in frustration with the way medicine is practiced here in the United States, particularly over the last 12 to 15 years. So the book is really my attempt to give readers and listeners and patients a look at the behind the scenes of how medicine is actually practiced and going over some of the shortcomings with science. I bring up the point that at least here in the United States, much of the practices are dictated by the pharmaceutical companies. Much of the research you have to take with a bit of a grain of salt, and make the point that what makes our trust in this system makes it easy for us to be fooled or deceived. We don't believe people that we don't trust. It's the people that we trust that are more likely to fool us. And I think some of that goes on in the field of medicine.
Yeah, no, I really appreciate you coming on and sharing these insights, because I think certainly there's a paradigm out there that doctor knows everything, right? Everything about your health. And as you've lived it for 35 years, you've seen how the system works. And it's not necessarily the doctor, it's the system that the doctor has to work within, right?
Correct. Most physicians have good intentions, but they're somewhat handcuffed by the system. Here in the United States, more and more physicians are employed. And whenever you're employed, you are easy to control, and you sometimes have divided allegiances between doing what's best for the patient and what might be best for the healthcare system that you're working for.
What was like, obviously you'd been in practice a long time and you've experienced a lot through your journey. What was the fork in the road for you? That moment, the fork in the road where you said, enough's enough and I'm going to break this, well, I'm going to leave the system.
Okay. Much of what's in the book, I probably knew around 2007 to 2008. But as I finally had the time to write something down. And as I was researching it, it was much worse than I actually thought. But what the breaking point was, one, I just really had the time to sit down and write. I have a website that I can write an article in an hour, depending on how much research. But to write a book, I really needed 3-4 hours at a time to do that. But the final tipping point was just the situation surrounding COVID. I thought there was, there is misinformation going out there, both from not credible sources, but also from trusted sources coming from within the medical profession. And I thought there was a lack of ethics on part of the profession, particularly physicians, during the outbreak.
Yeah, so it was really the straw that broke the camel's back was the COVID.
Right, correct.
Yeah. What were some of the signs that you picked up on during the journey leading up to COVID that wasn't sitting well with you? Like, what were you having to do, or what you couldn't do for your patients? What was some of this?
Well, maybe prior to COVID or when
Yeah,
COVID came out?
yeah,
Prior
so,
to COVID?
yeah,
Well, for the most, my first 2/3 of my career, I did sports medicine, and the focus on when we're dealing with athletes is on optimal health, optimal fitness. Then I got into the sick care model, and our goal there is just to kind of get people out of sickness. And in the United States, we really manage chronic disease as lifestyle related with an overabundance of medications. And I found that particularly frustrating. As physicians, we don't have time to really sit down and just get to the fundamentals of health, whether you have hypertension, diabetes, or high cholesterol. All those can be managed largely with exercise and nutrition. And the system is just not designed to allow that to happen. So it's easier just to write a prescription and send the patient on their way. So that was one frustration. During that time where I was practicing sports medicine, then got back into sick care medicine, there were a lot of new medications that I didn't know anything much I knew very little about. So I would sit down with pharmaceutical reps at lunch, and they would bring in lunch for me and my staff, and I would listen to their spiel. Yeah, I kind of could see the way that they would not manipulate the data, but they would focus on certain parts of the research. And most of the focus was on what we call relative risk reduction. If you take this drug and it reduces your risk of heart attack by 33%, that sounds impressive. What they don't tell you, though, is 100 people have to take the medication for one person actually to be spared that heart attack. So they're not lying. It's just that they're not telling all the truth. And part of the book, in the title of the book, there's the word half truths. And many times patients are only getting the half truth. They're not getting all the information they need to really make the best decision for themselves.
yeah.
So
Like I read somewhere or heard somewhere that I think it was one of the consulting companies, McKinsey, did a review for the pharmaceutical companies, and their, I guess, summary. Look, this could be a half truth, or it could be a bit of false news or whatever. But what, again, I don't know how credible this source is, but the executive summary was after their review was that that we would ruin the pharmaceutical model if we actually cured the patient. So we we don't want to produce medications that actually provide a cure. It's more medications that treat the symptoms. Now, what do you make?
right, we're treating symptoms largely with the medication. We're not getting to the root cause. Now, the problem we have, at least here in the U.S., the pharmaceutical companies do fund a lot. They give a lot of money to a lot of different organizations and groups. And if they're not healthy as a pharmaceutical company, that money's going to dry up. So they're kind of in this vicious cycle that the system is depending on the pharmaceutical companies to survive financially.
And what about the relationship between the pharmaceutical companies and the government?
Well, I don't get too much into the politics. I don't. Not sure I have a good answer for that. Certainly, the pharmaceutical companies are donating to politicians' campaigns. I think they're going to pass laws that are favorable. Although here recently, Pfizer has agreed to lower their prices here in the United States. So maybe we'll see some change.
And the other thing I've observed over time is that, there's this drug called a statin, which is, I
Mhm.
think, the most widely prescribed drug in the world, this statin medication. And my mother was in the medical system. And what she observed was over her time was that the threshold at which the medication would be given was kept being lowered.
Right.
Yeah, yeah.
So there's a term I write about in a book called medicalization, and so it's just an attempt to get more and more people on medication. So all the metrics, whether it be high blood pressure, diabetes, or high cholesterol, they keep getting lower and lower. So if you're going to meet those metrics, and there's a lot of pressure for you as a physician to do that, sometimes the only way you can do that is to get patients on medications.
Yeah, I can imagine there's pressure from the insurance point of view too, because
Right. Well, that's a good point. So, we're supposed to be practicing personalized medicine or individualized medicine, but in reality, we're practicing population-based medicine. So we'll take all these people who have high blood pressure, we'll put them on medication, but only a few of them are going to be spared a heart attack or a stroke. And that gets me back to another point. We kind of mislead the patients on why they're taking the medication to begin with. You're not really taking a blood pressure medicine to lower your blood pressure or a diabetes medication to lower your sugar. You're really taking those medications to prevent the complications of those conditions, such as a heart attack or a stroke. So we can give you a medication and we can demonstrate that your blood pressure is lowered and therefore you think you're benefiting from it, but only a small number will actually be spared a heart attack. So depending on the class of medications for blood pressure, anywhere from 86 to 140 people have to take a medication for 5 years to be spared one cardiovascular event. So in other words, 99 of 100 aren't going to benefit from it. But from the insurance company's standpoint, it's worth paying for those 99, even though not going to benefit, if it prevents that one heart attack, which saves them a lot more money. They're kind of like a casino. They're hedging their bets, basically.
And
there's I was going to say there's an assumption there that if those 99 don't benefit from it, we're not hurting them. But that's not true. If you're on a medication long term and all these drugs are blocking something biochemically, well, then somewhere along the line, you're altering your physiology, and who knows what kind of effect that's having on you 5-10 years from now.
Very true. Very true. And that just requires you to take more medication, right? To treat the other
Right, yeah, once you get on that first medication for chronic disease, you're going to be on a second and third one in a few years.
Yeah, you can see why these pharmaceutical companies are making a lot of money year after year. And yeah, I was also thinking from the insurance point of view, from a doctor's perspective, is that if they go outside of scope of, going outside of scope of practice would be not adhering to what they're taught or the system. And if there's any implications or problems, then, that's considered malpractice. And so they're sort of encouraged to stay within the system in order to have the insurance cover in case something happens. If they did everything according to the books, yet the patient has the heart attack or whatever, there's no recourse, back to the doctor because,
right. Yeah, as a physician, if you do everything the way they want you to, you follow the standard of care, you're protected in medical legal practices. So if you do go off or outside the system or not follow the guidelines the way you're supposed to, and a patient runs into trouble, then you're going to probably get in trouble yourself.
Yeah, so it's really hard to do anything outside of what's prescribed to you, in terms of, okay, if the patient's blood's X and, we've set a limit as Y or whatever, then the doctor is doing duty of care or, fulfilling their obligation by actually prescribing medication to lower that. So it's a really hard situation that doctors find themselves in because I often, they know, like as you shared, that they're not treating the root cause. As you said, like you could take blood pressure lowering medication, but still have a heart attack because it might not be the blood pressure that's causing problems. It might be something else that you're doing that you aren't addressing.
Correct. Right. Yeah. So here in the United States, we kind of dummied down preventing heart disease to treating high blood pressure and high cholesterol. But exercise itself will actually give you a better health benefit in cardiovascular reduction than any medication will.
Wow. And so what's your thoughts on, like, now, given that you've got this broader lens that you're operating from and you've done all this research, what do you believe are the main causes of heart disease or heart attacks?
Well, it's certainly multifactorial. Most of it is going to be related to lifestyle, being overweight, highly processed diet of foods, a sedentary lifestyle, stress. I mean, those would be the big four. Now, some people do have a genetic predisposition, and in those cases, that's where the statin drugs can certainly be very helpful and appropriate for use. The main thing is we just jump to the medications without even trying anything else first. And that's, I just think that's wrong.
And it would have been, I guess, hard for you coming from a health optimization point of view to then having to then look at the world from, okay, I know that, from working with performance athletes, that diet makes a big difference in terms of health outcomes and health, blood tests and results and all that stuff. I know this type of exercise helps. I know that sleep helps. And so that was a real, I guess, eye-opener for you, wasn't it, when you went from that sort of health optimization to
Yeah, from the deal with the athletes again, we want them to get them optimally functional. And you would think that would be the goal of medicine, but it's not. It's just to get you out of sickness, and we kind of get you out of sickness, but we don't necessarily improve your quality of life or have you live a life of energy. I believe if you ask most patients what they want from their health, if you could distill to one word, it's energy. And ironically, a lot of the medications we prescribe interfere with that, our ability to make energy.
Yeah, incredible, because it sort of makes the patient stuck in the system. There's no escape.
Yeah, we create medical dependence on
Yeah,
them.
yeah.
And I
Yeah.
talk about that in the book. It actually goes back to your first encounter with the healthcare system is when you're in your mom's belly still. And then, the first 2 years of life, you're seeing doctors all the time. So you just get kind of used to seeing doctors. You just think that's normal. And then you're told to trust them. And then we as physicians are told to trust our education and just stay within that box. Don't go out. Yeah, it doesn't always work though.
It's great to be speaking to a physician that's seen the other side, and that was, you working with performance athletes and on health optimization, and then you going back into the system and then realizing, nah, this is wrong. And obviously,
Yeah,
right.
so I got out of that. I got out of it 3 years ago. I'm kind of, I don't take insurance anymore. So it frees me up a little bit, but not entirely.
And so, I mean, obviously, you've written a book. We're speaking about the book or aspects of the book. What else do you do today in your field of interest?
So I still practice. I've cut down my hours. It's more than a preventive health clinic. With the emphasis on exercise, nutrition, and we do a lot of hormone replacement. We have a big fitness center with our practice, and we have a section for recovery because recovery after exercise is very important. We also have a sports development center, and this is mainly for high school kids where they can work on some of their skills. And we have coaches that work with them. Our director is a former NFL player, a National Football League player. And so we offer a lot, and it's a membership model. You pay X amount of dollars per month, and you have pretty unlimited services. We do exercise treadmill testing, VO2 max, bone density, body composition, metabolic rate. We have a red light, a bed, cold plunges, and soon a sauna.
Wow. So it's very,
It's kind of one-stop shopping, or
yeah,
at least mostly one-stop shopping.
yeah, wow. And where's your clinic?
It's in Columbus, Ohio.
Yep.
And we're about a stone's throw away from the Ohio State University,
Okay.
which is one of the bigger colleges here in the U.S.
And what about, I guess, people that are outside of Ohio, in other parts of the state? Did you offer online support, or do you do anything?
No,
No,
not yet. I've
no.
thought about doing that. Now, I do have the website, jackomd180.com, that has 1,100 some articles that date back to, 12, 13 years. Usually one or two articles are added each week. Yeah, I'm 65 right now, so I'm trying to, I'm kind of at a transition, trying to figure out. I love learning, but I'm at a point, well, I like to learn, but if I can really use it, I'm not sure how much of it I can actually employ in the practice.
Sure, sure. I totally understand. I really appreciate you coming on, sharing your insights. Like, just in terms of leaving the listeners with a key point, if you've sort of woken them up to, I guess, the other side, or I don't like saying the dark side, but it's sort of a more holistic lens of the medical field. How do you suggest what next steps should they take in order to sort of start liberating themselves from the system and really taking a step forward in terms of empowerment?
Okay. Why would I recommend strongly that everybody do their own research? I personally don't mind if people go to Google. They're told not to all the time, but I find it very helpful because it gives me insight to what they're concerned about. They might be concerned about cancer when there's zero chance that they have it, but at least I know what they're concerned about. And sometimes I get some helpful ideas from patients when they do their own research. I would also, and you can, everything that I have access to as a physician, everyday person has access to that same information these days with the internet. I think another going to be a real useful tool for patients is going to be artificial intelligence. You can just put a question to ChatGPT, like what's the number needed to treat for high blood pressure medicine over 5 years, and it will give you an answer. And then you're kind of armed with that information when you go to see your doctor. And if he's trying to, I mean, you want to be polite with your physician. You don't want to create any, you don't have an antagonistic relationship. Well, you might politely suggest, do I really need to be on this medication? I've read this, and maybe plant the seed to your doctor. In the United States, I'm not sure how your system works, but everybody's conditioned to use their health insurance. And as a patient, you can get anything you want done if you're willing to pay out of pocket. So I think there are sometimes you have to go outside the system, outside the insurance world to get the best care. I would recommend looking for people in your country or in your area that do more than just the traditional medicine. There are some organizations, functional medicine, integrative medicine. Some of these have physician directories that you can look up, physicians who are maybe more holistic or integrative in their approach. And I think the other thing that's helpful is we have a variety of healthcare practitioners now. You have physicians, assistants, nurse practitioners, naturopaths, acupuncturists. And I think as what they do gets better known, patients are beginning to realize that there's more than one way. There's more than surgery and medication.
Yes.
So I think that's helpful. That's certainly helpful for the patient.
So go on their own education, empowerment journey. And I think in the previous episode you shared a really good point, and I'm probably misquoting this, but it was sort of see your doctor as like a partner or a support as opposed to the boss, or a guide, as opposed to a dictator.
Well, it should be a partnership. The problem for patients is you got to have a physician who's willing to be your partner.
Okay. Yeah.
And so we've kind of gravitated to this attitude. I'm the doctor. You're the patient. You're going to do what I tell you. And if you don't do it, you're not going to be in the practice.
Yeah. Okay. Yeah. So it's a two-way relationship, and and it probably requires you actually shopping around, if that's the term, but actually finding the doctor that best suits your needs. Yeah.
Right. And many times the best referral for a doctor is someone you know. Do they like their doctor? Why do they like them? In terms of physician, you want someone that's going to listen to you, someone that maintains eye contact, that's not on the computer the whole time, someone who's going to answer your questions. And quite honestly, someone that's going to actually examine you. That's becoming a lost art, the physical examination. We're relying so much on technology and imaging studies and blood work that we forget to just examine the patient.
I really appreciate your insights, Dr. Joe Jacko. It's been great to get more insights around your book, Bamboozled, Duped and Hoodwinked. Where can the listeners find purchase a copy of the book?
Amazon. And do y'all have Barnes & Noble there?
Yeah, we do. Yeah.
Okay. So Barnes & Noble, those would be the two main ones. There might be some smaller outlets. I wouldn't know who they are though, at this point.
Yeah,
right.
I think we have access to Barnes & Noble through the online, not physical stores, but through the online. Yeah, so I'll include that link in the show notes so the listeners can go directly there. And again, I appreciate your time and really providing insight and education around the medical system. And, it comes from, I guess, all that experience that you've had through working within it. So it's very credible and, nice to hear an alternative and that empowers others and frees them up to go on their own health journey and start to taking more ownership and accountability in their health.
Sure. Well, I appreciate the opportunity to be here.
Thank you. Thank you. Podcast disclaimer. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast.
This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, me&my Health disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of me&my Health.